Welcome to this explainer. Today, we're going to unpack something truly ambitious. We are looking at Nepal's strategy to care for its citizens literally from cradle to grave, all based on the latest NSSD program report. We're going to pull back the curtain on a massive, intricate system that is out there touching millions of lives every single day.
So let's just dive right into the deep end here. How do you actually build a healthcare safety net for an entire nation? Especially when you're dealing with extreme mountainous geography, highly scattered rural populations, and honestly, pretty limited resources. It sounds like an impossible, monumental challenge, right? But the data coming out of Nepal reveals this really fascinating, multi-layered approach that weaves together everyday local volunteers with high-tech specialized hospital wards. To make sense of the whole shebang, we're going to follow a life cycle approach. Our roadmap for today breaks down into 5 distinct stages. First, volunteers and early life. Second, health in the classroom. Third, crisis and social services. Fourth, treating impoverished citizens. And finally, caring for senior citizens.
Okay, Section 1, Volunteers and Early Life. Let's start at the absolute very beginning, with a genuinely massive grassroots effort. Wrap your head around this staggering number, 50,396. That is the number of female community health volunteers currently operating in the country. They are the absolute backbone of Nepal's rural healthcare. Established way back in 1988, this volunteer force is basically an army of care, deeply embedded in local communities, meaning the health system actually comes directly to families before they ever have to set foot in a clinic.
And they aren't just out there handing out pamphlets. They are providing highly tangible, life-saving care. They're guiding thousands of safe home deliveries, making sure crucial practices happen, like immediate skin-to-skin contact and applying chlorhexidine to umbilical cords, which literally stops fatal infections in their tracks. They also screen toddlers for severe acute malnutrition using simple arm measuring tapes, catching developmental red flags before it's too late. It is absolutely crucial work.
But hey, no system is perfect, right? They're definitely facing some growing pains. They're trying to balance incredible strengths, like women's empowerment and unparalleled community trust, against some real structural weaknesses. The data shows they're dealing with an aging volunteer force that doesn't really want to retire, some sneaky recruitment loopholes leading to nepotism, and literacy barriers among the older volunteers, which actually messes with the accuracy of national health reporting.
Moving on to Section 2, Health in the Classroom. Because as kids grow up, their needs shift from just basic survival to holistic well-being.
Recognizing that healthy students simply learn better, it just makes sense. The government is taking that safety net and dropping it right into the education system. They've placed dedicated nurses directly into over 1,300 schools. The whole goal is to lower absenteeism, provide emergency first aid, and completely flip the script on how young people manage their own health.
Now here is a fascinating little twist about how this gets paid for. You'd think the federal government foots the bill, but the national division actually only supports about 19% of these nurses. The local provinces? They have totally taken ownership, independently funding over 80% of the program. It is a massive indicator of how much local communities value this initiative.
And these school nurses are doing way more than just handing out ice packs for scraped knees. Their mandate is huge. They're tackling the tough, sometimes taboo stuff: adolescent sexual health, menstrual hygiene, nutritional tracking. Crucially, they are right on the front lines of the youth mental health crisis, providing counseling for stress, anxiety, and even stepping in for suicide prevention. They are real game changers.
All right, Section 3, Crisis and Social Services. Because as people become adults, they can hit some incredibly rough patches. The system has to catch them when they fall.
The demand for help right now is absolutely surging. The social services units, which basically act as subsidized safety nets for marginalized folks and disaster victims, saw their case volume literally double in just 1 year. They jumped from around 37,000 cases to over 78,000. That spike tells us 2 things. Hospital coverage is expanding, but also there is an intense, urgent need for financial protection out there.
But there's a heartbreaking silent crisis going on as well. According to the National Health Surveys, a staggering 58% of gender-based violence survivors never seek help. They don't tell anyone. Fear of stigma and the lack of secure support systems keep the vast majority of these tragedies completely hidden in the shadows.
So, to tackle this securely, the government set up one-stop crisis management centers across all 77 districts. When survivors bravely step forward to these centers, the numbers paint a pretty grim reality of what they've endured. The majority of cases are physical violence at nearly 27%, followed by emotional violence, and tragically, rape accounts for nearly 17% of new cases. But here is the most important part of these centers. They don't just patch up physical injuries and send people away. They offer a holistic safety net. In fact, the most utilized service is psychosocial counseling. They provide a whole suite of care: physical exams, HIV testing, critical medical legal support, all in one secure location. It's designed specifically so the survivor doesn't get re-traumatized by bouncing around a fragmented legal and medical system.
Which brings us to Section 4, treating impoverished citizens. Let's talk about the heavy, terrifying burden of chronic illness and what happens when getting sick threatens to completely bankrupt your family.
Imagine getting hit with a catastrophic health shock. For families in poverty, the government runs the Bapana Nagarik program. This is a literal financial lifesaver. It's a treatment fund that steps in with critical subsidies. Last year alone, it paid for the treatment of over 41,000 impoverished citizens battling severe, life-altering conditions.
To make the money stretch, the fund has targeted financial caps for 8 major diseases. For example, they'll cover up to 400,000 rupees for a kidney transplant, and up to 100,000 rupees for things like cancer, heart disease, Parkinson's, and spinal injuries. It's a very specific, targeted approach meant to act as a firewall, stopping families from falling into absolute destitution just because someone got sick.
And this is where the reality of Nepal's health landscape really hits home. If you look at how that massive 4 billion rupee budget is spent, nearly half of it, almost 50%, is entirely consumed by kidney disease. Mostly, that's the incredibly high ongoing cost of hemodialysis. Cancer and heart disease take up the next biggest chunks. It's a massive wake-up call about the rising wave of non-communicable diseases.
Finally, Section 5, caring for senior citizens. We are entering the twilight years, and Nepal's demographic landscape is shifting faster than almost anyone expected.
Thanks to massive public health victories over the last few decades, life expectancy has shot way up. There are now nearly 3 million Nepalese citizens classified as seniors. That's over 10% of the entire population. That is a huge success story, but it fundamentally flips the nation's healthcare demands upside down. We're moving from a primary focus on maternal and child health to suddenly managing long-term, complex conditions for the elderly.
So, to catch up to this new reality, they are aggressively expanding dedicated geriatric wards. Right now, they're operating in 61 hospitals and treated over 74,000 elderly folks last year alone. And what are they treating? Predominantly, it's cardiovascular and respiratory issues, complex morbidities that require highly specialized continuous monitoring and care.
But here is the catch. While it's fantastic that national policies and budgets are finally prioritizing the elderly, they are in a dead sprint against time. The biggest threat to this whole system is a severe lack of specialized human resources. There just simply aren't enough trained geriatricians to go around, and the aging population is growing way faster than the medical schools can output specialists. Which leaves us with a pretty big question to ponder. We've just watched how Nepal is hustling to weave this massive safety net together, from those grassroots volunteers trekking through the mountains to high-tech dialysis wards. But as global lifespans keep increasing, is your own community actually prepared for this inevitable wave of aging populations and chronic disease? Looking at blueprints like this helps us figure out what we all need to survive and thrive in the future. Thanks so much for joining me on this explainer. Keep questioning and keep learning.